So, I'm Dr. Trinka, and the name of this webinar is How Can Using Prisms and Eyeglasses Help Me? So, I have some credentials that we can look at, and I'm a neurooptometrist, which means I use a certain prescription and modify it to try to influence brain function. I'm a certified nutritionist and have been for over 20 years. I am practiced clinically in using light therapy, and that's called symptonics. And so I'm a symptonic optometrist, and I've been doing this for over 30 years. So that's who I am. So prisms are difficult, and not so much in terms of their application, but in terms of if you don't have any background about prisms, it's a foreign concept. And so I'm going to do my best today to try to make it clear. Most people, when I say prisms, they understand a triangular piece of glass or plastic that splits white light up into the colors like this. And so this is what I would call a prismatic effect, although the usefulness of this picture is brought out by the fact that prisms are represented by triangles, which means you have a base and you have, we call the top of the triangle the apex. So you have a base and an apex. So this is not what I'm talking about when I'm going to have this webinar about prisms, but this is what most people think prisms are. So let me clarify. Here's the concept that I want to push, or the concept that I want to talk about. When light hits a prism, it always bends light towards the point of the triangle. And depending on where the base of the prism is, it's going to stimulate the retina in that direction. So if I have a base that's down on the bottom of your glasses and it's pointing up in both eyes, I'm going to stimulate the inferior retina, and it's going to bend light so things look higher than they normally are. It's going to bend light, so your perception of things will be elevated. So I think this says it all, and that is that prisms are very powerful. And I've been using prisms for over 30 years, but I've not gotten the true effect that this tool can have on brain function until about the last 5 or 6 years. And what I've realized is that because you can influence how light goes into the retina, you can therefore influence how your brain works. And this is particularly useful when you have symptoms. So what symptoms? So these are the symptoms that I deal with all the time. If a person's dizzy, they have headaches, clumsiness, they can't think clearly, brain fog, they have memory problems, speech and language issues, like they can't retrieve words, cannot read efficiently. They get super tired if they read for any amount of time, or they can't remember what they read. People who have ADD and ADHD, focus and concentration issues, can be helped with prisms. I typically see motion and light sensitivity problems in the traumatic brain injury population. And so when things go zipping by in the periphery of their eyesight, it really bothers them. Um, People who have abnormal gaits or postures can be helped by prisms. So many of these things are due to brain problems as a result of an accident or a concussion. Some of them have nothing to do with that, and they're more developmental, or um, they can be related to toxicity or lack of nutrition. There's all kinds of reasons why brains don't work the way they're supposed to. And this is a tool to help a brain work more efficiently. So when we talk about prisms, remember this prism is visualized as a triangle. There's two kinds that we use in neurooptometry. The first type is called a compensatory prism, and the second is a yoked. And they have to do with where the base of the prism is in front of each eye. Before I go any further, I should probably say something like you can't tell that prisms are in our eyeglasses by looking at them, unless they're just obnoxiously huge. So when I have a pair of glasses that I prescribe for a patient, as you look at them, they look like any other glasses. They're not like little triangles in them. I just thought I would make that clear. Um, so there's these two kinds, and they're differentiated by a whole bunch of issues. One of the issues, this is a really key issue, is where is the base of the prism? Are they on the same side in the right and left lens of eyeglasses, or they are on opposite sides? Compensatory prisms are always on the opposite sides. Like, so if I have base up in one eye, I'll have base down in the other. If I have base in on one eye, I'll base out on the other. And so when I have a compensatory prism, I am going to try to reduce the stress of fusion. And of course, that's a huge deal. So let me talk about that for a little bit. Compensatory prisms, otherwise known as non-yoked prisms, changes the perspective of where an object is. In other words, it changes where you think it is. And so if I'm looking at a prism, or excuse me, if I'm looking at an object and I use Basin Prism, I'm going to make that object look further away than it really is. Um, so I want to talk about fusion issues and binocular stress. So the main concept here is that there's an effort to fuse the image from one eye and the image from another. And when you fuse those two images from the right and left eye, there's a certain amount of effort that's based on how your eyes are aligned naturally. So, for instance, if I have one eye that is pointed up a little bit, and then I have another eye that's pointed down a little bit, then there has to be some kind of effort in your brain to take the two images that are not at the same level and put them together. And so that's what I call fusion. And so when there's a lot of difference between the horizontal plane that your eyes are at, and you could look at somebody and they would look like they had eyes that are straight in their head and not one pointing up and one pointing down. But when you do testing about this, you can see that for sure one eye's pointing up a little bit and one eye's pointing down a little bit, if that's your condition. And there's increased stress to go ahead and make the two eyes meld into one image in your brain. as opposed to when the two eyes are lined up on the same plane. Similarly, it's the same thing if your eyes point in or if your eyes point out. You have to overcome that natural position of rest of your eyes to produce one single image that goes into your brain that you can make sense of. So, compensatory prisms compensate for differences of where your eyes point in what we call the natural position of rest. And so this is where a ton of symptoms show up. And if so, this is the Terry Trink theory of understanding visually what's going on in your environment. So let's say that you have 100 units of energy to read a chapter in a book. My question would be, how much energy do you want to get that information from the book or the computer screen into your brain? And how much do you want left over for comprehension, understanding, and memorization? So ideally, it would be zero, right? Zero effort to get it in, and 100 units to go deal with the information in whatever way you need to deal with it. So many people do not have this. They expend enormous amounts of energy to get the information into their brain, and therefore they have much less to go deal with the information that they just got into their brain. And so their comprehension suffers, or their memorization suffers, and they can't remember anything, and they don't understand very well. And these are all because their eyes aren't aligned. And the effort to try to put their images from the right and the left eye into one fused image in their brain requires so much effort that they don't have much left over for doing the things that they want to do. Hopefully that seems clear to you. So there's base in, base out, base up, and base down, and these are compensatory prisms. And I would have to tell you that all eye doctors are trained in this as they go through optometry school. But my guess at how many use it on a regular basis, if they're not a functional, a behavioral, or a neurooptometric optometrist, is probably less than 30%. So when you go to get an eye exam from a chain or from an eye doctor that's not functionally trained, then they won't do the tests to go ahead and determine whether or not you have stress or fusion issues that can be massively helped with prisms, with these compensatory type prisms. And so they miss an opportunity to help. And so you're labeled as ADD, ADHD, or slow, or and you have headaches, and you can't concentrate, and you have no stick-to-itiveness when you're assigned a visual task because the effort and fusion is so high. Hopefully that makes some sense to you. So when we have base-in prism, which is a compensatory type of prism, it's useful for people who have to turn their eyes in when they read. Well, everyone has to turn their eyes in when they read, because your eyes, when you drive, are looking parallel. They're parallel to each other. And then, of course, the closer you bring something, the more your eyes have to turn in, right? And so some people lack that ability. And so you can move the image that you're looking at, say it's a book or a screen or whatever, and you can use Basin prisms to push that image out so you reduce the convergence demand. And sometimes people actually get doubling up close, especially when they're tired. They look at words on a screen and they're going single, double, single, double. I don't know how anybody can make sense of the information in the written word when you're playing the game of is it single or is it double? And so this is extremely useful in terms of reducing the convergent stress when a person has to rotate their eyes inward to do any close-up work. Admittedly, that this is a kind of a band-aid approach because the glasses don't cure an inability to turn your eyes in. It just compensates for the fact that you can't. And I think that that's a really important point. Now, there are brain exercises and eye exercises to do to go ahead and stimulate that ability in your own brain. But as a tool to go ahead and help therapy, it is very valuable. And some people will never do the therapy because they're not interested in it. They just want the tool. Just like if you had a headache every day at 3 p.m., many people would not want to figure out why they have a headache at 3 p.m. They would just take ibuprofen or Aleve and they would not think twice about it. So I'm a person who would want to know why and how to use the holistic therapies to try to figure it out. But while I'm doing it, this is an extremely useful tool. So that's Basin Prism. So of course, what's next is base out prism. So now you have prisms on the outside of your eyes, and these are helpful for people that turn their eyes in too much. And so what you want to do is bring images to where their eyes want to point. And many people with overconvergence have, when they get tired, they'll do work all. I've seen this so many times. They'll do work all day long at a screen, and then they'll drive home, and they want to shut one eye to drive because things start to double because they're so used to converging up close, they can't diverge to go ahead and drive. And so base out prism. Now, this can happen up close too. I mean, I tried to make it simple in these slides, but you can have overconvergence up close, just like you can have underconvergence and distance. But that's not the norm. That's not the usual thing that we see. We definitely see underconvergence being a problem when a person has to do a lot of close-up work, especially a kid in school. See this all the time. Or a person that has underconvergence and they have to do a screen-based job, which is definitely more popular now. But the basic point here for base out prism is it helps the image come in closer to you so that it is where your eyes want to be. Just like in underconvergence, it pushes the image out so it is where your eyes want to be. So, and your eyes are more diverged to the relative to the plane of what you're looking at. So this reduces it, doubling at distance. Again, the same thing. The ultimately best thing to do is to do vision and or brain therapies to strengthen the system of divergence so that you don't need base out prism. However, jumping right into those therapies can sometimes be too much. And so it's very useful to use as a training tool base out prism to go ahead and make it easier as a starting point to start doing these therapies. So the next one is vertical prism. And we talked about this before, that vertical prism causes a misalignment of your eye vertically. So you can have one eye up and one eye down, or one eye down and the other eye up, either way. And so I find this is very true for people that have had concussions or traumatic brain injuries. They often exhibit a vertical misalignment of their eyes. And of course, their effort to try to fuse those two misaligned eyes into one coherent image so that you can make sense of the environment in front of you is limited. They put out a ton of effort to do that. and it takes away from the rest of understanding what's going on visually. So in this case, we would use base up over the eye that's down and base down over the eye that's up. And it'll help align the eyes and reduce the stress that's needed to fuse two images into one. So moving right along, let's go to yoked prisms. So instead of yoked prisms being, instead of compensatory prisms being more of a where is the image and how can I manipulate the perception of the image so that my ability to fuse two images of my eye into one is lessened, and therefore I can pay better attention to my environment. Yoked prisms are much more about where you're at in space. And so this is not like I'm in Denver, Colorado, and I'm, in the foothills and I'm sitting in my office and stuff like that. This is, do I instinctively know where I'm at relative to gravity? And does my body respond well to that? And so yoked prisms move space. They don't move an object, they move the space around the object. When you move space, you are going to move body posture. And there's a part of your brainstem that yoked prisms activate to move your body. And so yoked prisms have prisms on the same side. And so a yoked prism would be, we refer to them as base left, or base right, or base up, or base down. So they're not opposites, they're on the same side. And so, so a base, for instance, a base left prism would have a base of the prism in front of the left eye and a base of the prism in front of the right eye that are on the left of the left eye and on the left of the right eye. So we're on the same side. And what this does is it opens up the space wherever the prism apex is. So if I have base left prism, it's going to push my whole left space forward. What that'll do is cause a compensation of my hips, and my hips will shift as a result of that. So that's why you get a posture shift and a space shift when you use a yoked prism. Yoked like oxen are yoked; they're yoked together. And this is a newer concept than compensatory prisms. Many people who never engage in functional optometry or neurooptometry don't have a clear understanding of how powerful yoked prisms can be. And the other part of yoked prisms has to do with the base of the prism stimulating where the retina is on that side. So let me explain. So if I have base up prism, then I'm going to stimulate and so that means that the base is up on top and the point is on the bottom. The apex is on the bottom. So it's like two triangles. You can imagine two triangles in front of each eye. So what that'll do is it'll shift space down, and my hips will make a corresponding adjustment. And I'll show you a picture about that in just a sec. And it'll stimulate my superior retina. Or if I have base down prism, I'll have a base at the bottom of the glasses and the apex of the prism up towards the top, and that will stimulate my inferior retina, and it'll move space up. And as it moves space up, it'll make my hips change to compensate for that. So who cares? Like, why do this? Well, many people have you can look at them and they have an odd posture. Their shoulders are changed. One shoulder's dipped down, the other one's like that. Their neck is back and forth. Their hips are changed like that. And yoke prisms change hips. If you change your hips, do you think you're going to change your shoulder and your neck position? Absolutely. And so that's one really big part of it. And when I learned to do this work, I became much more of a ninja in observation. And so I'm observing the person as they walk into the exam room just to see, do they have a normal gait and posture? And so many people don't, as a result of a trivial hit to the head when they were 5, or a concussion playing football, or they fell off a horse, or they got into a car accident, or something that may or may not stick in their memory, but it changed the way their brain figures out gravity and their posture for the rest of their life until somebody intervenes. So that's the one part. The other part is that stimulating a part of your brain can have stimulating a part of your retina so that you can stimulate a part of your brain. It can have profound effects. So let's talk about this a little bit more. So, as I said, base down yoke prisms is going to stimulate the inferior retina. Remember, this is like a triangle with the base at the bottom of the glasses and the apex at the top. And again, you can't see this when you look at a pair of glasses that has base down prism. And I'm a big fan of really minute amounts because this is one of those, I learned a long time ago that prisms, less is more. And it's almost like perfume, where a little tiny bit goes a long way. And it's pretty easy to overwhelm people with prisms. Now, some people need it because they have such massive fusion problems, but for the most part, we're using very small amounts here. So anyways, a base down yoke prism will, as I said before, you always stimulate the retina in the direction of the base. So if the triangle's at the bottom, then you're going to stimulate the inferior retina. Well, what we know through neurophotonics is that when you stimulate the inferior part of the retina, you shoot more signals to the temporal lobe. And so who cares? What's going on in the temporal lobe that I might want to change? Oh, little things like memory, language acquisition, mathematics, things like that. No, I'm kidding. Of course, it's really important. And when people have dysfunction in here, you can help their dysfunction often by sending more retinal signals to that area of the brain. I was dealing with a lady about a month ago, and she had a stroke, and she couldn't express herself very well. She couldn't talk that well because of where the stroke occurred in her left temporal lobe. And after doing my neural workup with her, I came up with the prescription that would help her the most, and it had a stimulation of the left temporal lobe. And I saw her for her first visit, and she said, I went to go talk to my counselor, and all of a sudden I could talk. And of course, she's not cured, but her abilities became so much better as a result of sending retinal signals to her temporal lobe. Now, there are many, many therapies to help temporal lobe function, and this is just one of them. But it sure helps if you can send signals so that the person's better able to take advantage of some of the other therapies that are available. I'm not saying that this is a standalone, because it usually is not. Sometimes it is, but most of the time it just helps other therapies happen. So, base down yoke prism sends signals to the temporal lobe, which can help all those functions. It expands your space upward. And what do you think will happen to you if you expand your space upward? I have people that hate looking down when they walk. It bothers them, but they have to figure out where their feet are going. And so sometimes I can use prisms to alter their space so they don't have to look down as much. And this, a base down yoke prism, will tilt your hips up. So let's go in the opposite direction. A base up yoke prism does exactly the opposite. It stimulates your superior retina and sends more retinal signals to the parietal lobe, where you integrate all of your senses. And so it's really useful sometimes to send more signals to the parietal lobe so people can integrate the senses from their ears and their eyes together, for instance. We obviously have more than that in terms of senses, but sensory integration disorder is something that is fairly well known. And not everybody needs to have the diagnosis of sensory integration disorder to take advantage of the fact that you can integrate senses like eyes and ears better. I have seen many people that when somebody starts talking while they're doing a visual task, they cannot. It's just like they can't register it, or vice versa. When they're trying to listen to somebody, they miss all kinds of details as a result of looking at things. In a well-balanced brain, you would hope that you could be doing both at the same time, and your mind has the opportunity to go back and forth and pay attention to what you want to pay attention to. So base up yoke prism will shift space down, and it'll tilt your hips forward, so they'll go down. So I have a little picture of this, and this is what I mean. So on the left here is an example of base down prism. It shifts your hips forward and it raises your space up, which can have phenomenally important effects on a person that has the symptoms that go along with this. That can be posture symptoms. They can be, temporal lobe symptoms. They can be, a whole bunch of different things, posture symptoms. And on the right, we have a person that this is an example of a person that would have base up prism. And so you can see that their hips tilt down and their whole space is shifted downwards. And this is the power of a prism. I've seen it work absolute miracles. I have a quick story for you. I had a patient come in, and actually, I'll save the story for the next slide because it's more relevant. So, as well as up and down, you have right and left, right? And so, base left yoke prism, as it says here, can expand and shift the space to the left. So it's going to take space and it's going to go like that. Now, why would you want to do that? Well, it's because that person's brain interprets the world in such a fashion that because of whatever reason, nutritional deficiencies, hit on the head, concussion, traumatic brain injury, toxic chemicals, whatever, their brain interprets space inaccurately. And so they see this as normal. They see the left eye, left space very far behind the right. And so when I bring space out in the left, it normalizes it so that they can interpret their environment much better. So, and this stimulates the left hemisphere of the brain as well. When you have base left prism, you're stimulating the left retina on both eyes. And because of the way the neurons cross and go to the brain, you're going to stimulate the left hemisphere of the brain. So what happens in the left hemisphere of the brain? Well, lots of things. And the things that I'm talking about are kind of all over the brain, but they're generally considered the mathematical, the sequential, the detailed, whereas the right hemisphere of the brain is the creative and the holistic and the that whole aspect of it, the musical, but in truth, all of those things involve all part of your brain. But you can accentuate a whole hemisphere of a brain instead of a part of your brain by base left and base right prism. And I think that can be really important. So here's base right yoke prism, and base right yoke prism expands and shifts space to the right and stimulates, of course, the right hemisphere of the brain. my mentor in Chicago had a woman come into her who was a writer, and she had writer's block, and it was driving her crazy. And she said to Dr. Z, can you do anything to help my writer's block? So Dr. Z did her workup, and she came up with stimulating the right hemisphere of the brain, which was more of the creative aspect of writing, which is what this person had a problem with. Lo and behold, a writer's block went away. I thought that was pretty interesting. Now, this whole thing is much more complicated than what I just said, but it helped her. And she laughed about it, and she goes, "Now I have a whole bunch of patients that are writers," which I thought was very interesting. So here's a picture of base right and base left and what they do. And so on the left-hand side of the screen, you have base left prism, and it shifts space over to the left-hand side, which will cause a corresponding shift in posture and a corresponding shift in your hips as well. And on the right-hand side is the base right prism. This comes from these two slides come from my mentor, Dr. Zelinsky in Chicago, who owns a company called the Mind-Eye Connection. So I'm giving credit where credit is due here. So my little story about base left and base right prism goes like this. I had a patient come in who wanted to do light therapy, and as I'm taking the history, she confided in me that she had 7 concussions. And I said, we should do a different kind of an exam other than a light therapy exam to find out if there's any lasting effects of these concussions. And as I was watching her walk, I noticed that she was extremely heavy on her left foot and light on her right. So it was like, just the way she walked. And it wasn't that subtle. And this was just as I was learning this. And so it was thankful that, I was grateful that it wasn't subtle. It was pretty obvious. So I looked at that and I thought to myself, well, what if we could unbalance her weight on her left and go over to her right? And so I used a pair of lateral prisms like we've just been talking to, and I put them in a pair of glasses that she could walk around the office with. So she walked around the office, and I sat in the examiner and I said, go do a lap or two and then come on back. And she came back and she sat down on the chair and she started crying. And I was like, uh-oh, what happened? And she said, Dr. Trinka, this is the first time in 10 years that I have not felt pain in my left hip. And that was so impressive to me that it made me want to learn as much as I could about this way of helping people. And so I've helped other people in this regard as well. But that stuck out in my memory that just by putting a pair of glasses in front of a person, you can affect their musculoskeletal system to take away pain if that's the right treatment. And it was exactly the right treatment for her. So I thought that was pretty impressive. So this is one of the final takeaways. Non-yoked prisms affect the target location, and yoked prisms move space and affect your brain stem so that it can change your body position. That is a huge takeaway from all of this. My conclusion is that prisms and eyeglasses can be extremely powerful in changing the way the brain perceives your environment and can alleviate many symptoms. And I've seen it happen day in and day out. And then, of course, I always tell people, it doesn't matter how long you've had the issue. We can work where you're at and move you to a place of better balance. So the final thing I want to say is I'm available either through integrated brain centers or through my own business, iBrain Connection, to schedule a free 30-minute consultation. And so if you'll take down either one of these web addresses or phone numbers, I'm happy to chat with you for 30 minutes about how this might help you. Here's my resources for this webinar. And All of them are excellent. I have great appreciation for each one of these resources to help me be the practitioner that I am today. And finally, if you can change your vision, you can change your brain, and it can change your life. I appreciate everybody being on here and listening to me. If you have any questions, I'd love to do a 30-minute consultation. Thank you.